Low vision rehabilitation doesn't save eyes, it saves lives. Hi, I'm Dr. Bhavani Iyer. I'm a low vision specialist and the director of the Dan Arnold Center for Vision Rehabilitation here at UTHealth Houston. I'm an optometrist, and the reason why I chose low vision in particular was because it resonated with me. Growing up, my grandpa had low vision. Somehow I was always passionate about this field. I felt like I could understand patients better, and I had the patience to deal with what it takes to treat low vision conditions, and I just love it. I was working in Michigan before I moved to Houston. And this is the only place that I felt like my philosophy fitted in with the department. And I can't imagine a better group of people to work with. So Courtney is a patient of mine. She's 14 years old. And in this clinic, we actually treat patients of all ages. But children are a very, very important part of our practice. So in Courtney's condition, she has a congenital condition called as oculocutaneous albinism, where she lacks the pigments that the rest of us have. And because of that, she has reduced vision. She has a condition called as nystagmus, where her eyes don't stay stable. There's a constant shaking of her eye. And because of that, her visual world is also shaking. So these are the children that we take. We like to intervene very, very early. We take them at a very young age, and we teach them and we connect them with devices that'll help them succeed in life. Not just in school, but we set them up for the rest of their life.
Hello, my name is Courtney Maye. I'm 14 years old and I'm in high school, and I'm lucky enough to have a doctor like Dr. Iyer. Before I got my tools, I was probably like 8 years old and in second grade. So I always used to have to sit by the teacher, right by her and right by the board. And it was really a struggle for me because especially we had to do a lot of group work. And so I couldn't do group work because I had to sit right up by the teacher. So I couldn't sit by any of my friends. And so that was one of the struggles alongside of, there wasn't really an easy way for me to see anything, and I would just be left out a lot of the time. I have 2 telescopes, and I use them especially at school to look at whatever is on the board or look at anything that's a far distance away from me, like posters around the room. And then I have a bar magnifier that I can use to read text, and then I use the Jupiter, which is similar to the video book. It's a CCTV almost, and it magnifies, and then I use a cane.
So CCTVs basically stands for closed circuit television. These are electronic magnification tools that allow patients to read with magnification. So when they cannot read standard print, in the past, they used to have to make the font larger. Now what they can do is just take that standard font and stick it under the CCTV and read it with magnification. So Courtney is 14 years old now. In another year or two, she's gonna want to drive, just like how everybody else wants to drive. And it's not just about driving, right? It's going to set her up for the rest of her life. That's gonna mean that she can go get a job or maybe go to college away from her home. And those are all life experiences that she deserves just as much as anybody else. What we are planning to do in her case is we're gonna try and fit her with a bioptic telescope to help her meet the legal requirements for driving. She can't go to the DMV when she turns 15 to go get a driving license or a driving permit like the rest of us do. She's going to need extra help. That is the reason why we like to see these children at an earlier stage, so that we can catch them and we can treat them and we can train them and we can get them adjusted to their vision loss and set them up for success. One of the best things that other physicians, people, parents, family can do for low vision and vision rehabilitation is awareness. Ask for help. Don't be afraid to ask for help. And know that there is hope. When you feel hopeless, ask some more, ask again, and dig deeper.
If you have low vision, don't worry. There is always ways to improve your vision, and there's always an opportunity for you, even if you may not think so. Don't define yourself by any of your disabilities, because we all matter in this world and we're very important and we can do anything we put our minds to.